Thank you so much for joining us today. I'd like to start by acknowledging the land where I'm speaking to you from today. Of course, while we're meeting on a virtual platform, I'm tuning in from the traditional territory of the Haudenosaunee, the land of the Anishinaabe, the peoples of the Mississaugas of the Credit First Nation, and the Huron-Wendat Nation. This is covered by Treaty 13, the Toronto part of the Toronto Purchase Treaty lands. For those of you who have heard me do a land acknowledgement before, you know that I live within walking distance of the beautiful Humber River that this picture depicts. And I spend a lot of time there with my two kids. There's a park just around the corner from my house where I spend a lot of time in the summer at the local baseball diamond. And this park actually intersects with what was once a major trade and portage route for Indigenous people for many years and long before settlers colonized the area. I am always really conscious of that as I take up space on this land and feel incredibly privileged that I'm able to live, work, and play in that land. As team members at OCO, we're all continuing to learn about the lands from where we work and really to explore how we can be meaningful allies and support the recommendations from the Truth and Reconciliation Commission. All right. So welcome. So what you will be taking away from today is thinking about really an understanding of why it's important to build caregiver support strategies and how to implement them into your OHT models of care delivery across your organizations. You'll also hear firsthand caregiver insight about which interventions can really make a difference to caregiver well-being. And we're also introducing two new practical resources to enable OHTs and organizations to better support caregivers across settings. So before we get started, I wanted to take a moment. Yep, we're on track there. Thanks, Verdosa. To introduce myself. My name is Allison Kilborn. I'm the manager for our Essential Care Partners Support Hub at the Ontario Caregiver Organization. I am delighted to be joined today by Catherine George, a caregiver partner who has partnered with us on a number of things at OCO. She's a peer support mentor, an OCO advisory council member, and an amazing speaker. You're in for a treat today. I'm also really happy to be joined by my colleague, Lisa Rafoul. Lisa is an implementation lead at the Essential Care Partner Support Hub and has the privilege of working with a number of healthcare organizations. Lisa will be helping us at the end of our talk today as we have a bit of a fireside chat. So now let's kind of get started, and with that, I'll just provide a bit of a kind of background on, who is OCO. So of course, you might already be familiar with us, but in case you're not, we exist to improve the lives of Ontario's 4 million caregivers. Of course, no matter the age, diagnosis of the person, who they're caring for, or where they are in Ontario. Or a non-for-profit organization and charity funded primarily by the Ministry of Health. Caregivers, of course, are at the center of our work. We offer a variety of free programs and services in both English and French to caregivers across Ontario, including a 24/7 helpline for caregivers to direct them to supports and services they need for themselves and their care recipient. Our work also, of course, includes gathering insights from caregivers and engaging caregivers in our own program development and design. As part of our work at OCO, we also, of course, help healthcare organizations, including OHTs, to implement caregiver inclusive practices to improve patient and caregiver outcomes. And we approach our work focused on 3 key pillars, which if you've joined some of our webinars before, you may be familiar with. But these 3 key pillars really overlap and influence each other and really focus on the identification and recognition of caregivers at point of care, including caregivers as partners on the care team, and connecting caregivers to support for their own needs. Of course, at the foundation of this work is how caregivers are engaged in the planning and design of all of those pieces of the puzzle. So OCO offers large-scale learning events for OHTs like this one, tailored education sessions for providers, tools and resources to support you in your work. And we collaborate with healthcare organizations and OHTs like yours by providing guidance and support for caregiver inclusion initiatives across OHTs, and we can work with you to connect caregivers to support. I'm really delighted now again to pass it over to Catherine George. Again, Catherine's a caregiver partner, peer support mentor, and advisory council member with OCO. Catherine is going to speak to how caregivers are doing in Ontario and also her own experience as a caregiver. I do want to also give the heads up before I pass it to Catherine that Catherine's talk will reference the grief and loss of a child. And this might bring up kind of feelings for those of you who have a similar experience. So I wanted to give everyone fair warning. Take it over to you, Catherine.
Thank you. So I want to say bonjour, hello, and Ani to everybody that has been able to come to this presentation today. So I thought it was important that, before I give my caregiving journey, that we just talk about that every year the Ontario Caregiver organization gathers insights from caregivers all across Ontario, and this slide depicts some of those statistics. The experience across caregivers of Ontario. So 4 million people across Ontario are caregivers or active caregivers, and this includes young caregivers. And so when we look at it by age group, we can see about 14% are between 16 to 25 years of age, and that's that young caregivers group. And then about a third each are between the 24 to 45 year age group, and then 46 to 65. And then we have a smaller percentage back at 65 years of age. The gender distribution is roughly equal, where we have about 52% are identified as women caregivers, with 56 identifying as men, and 2% non-binary. And then 67% are employed. I wanted to reflect a little bit about where I sit in Ontario as a caregiver. So I'm situated in the northeast region of Ontario, and I belong to the age category of 26 to 45 years of age, and I'm a woman, and I'm employed full time, and I fit into the role of what they describe as a double duty caregiver, meaning that I worked in a role of caring for others. I work in healthcare, and then I go home and have a role of caregiving in the home as well. If we reflect the specific needs and experiences of caregivers in Northern Ontario, including Eastern and Western Ontario, Northern Ontario is vast and beautiful, and it generally has a very low population density with great distances between the communities. Northern Ontario has a higher percentage of population that is over the age of 55 than urban areas. And in Ontario, in generally, the basket of services in rural and northern communities is less comprehensive, with availability and accessibility to services. Individuals living in northern communities often need to travel to urban areas to access the healthcare services needs that they need. And then 40% of rural caregivers report financial challenges being a main stressor in their caregiving experience. Next slide. So Ontario Caregiver Organization also put out a recent spotlight report that shows that 32% of caregivers say they are not coping well. The majority say they are feeling depressed, unappreciated, resentful, lonely, and frustrated. 72% feel so burnt out that they're unsure how to continue, yet they feel that there's no choice, so they have to keep going. And 75% are concerned that they will not be able to handle their caregiving duties going forward. So again, like caregivers who are distressed experience adverse health outcomes, the deteriorating mental and physical health, negative impacts of social and family relationships, and even have an increased risk of death. And caregivers are most worried about dealing with the care recipients' declining health, making sure that their needs are met, and balancing caregiving with other family responsibilities. Next slide. So I wanted to talk about my caregiving journey and what it was and where it is currently. And on these slides, you're seeing pictures of my family, and the focus really was on my son. His name was Riker. He was born in 2020, and he died in December 2022. Um, Riker, I had a very typical, I did not have a typical pregnancy. I was high risk and it was unrelated to him. And he was born in June of 2020. He was developing fine, reaching his milestones for the first 2 months. And then one day, when he was 2 months old, he was exhibiting some seizures. And I lived in a rural community at the time in Northern Ontario. And so I did go to the rural community hospital. And by saving grace, I really do think it's because of my healthcare background. I had video recorded the seizures that were taking place, and I was able to show the locum physician the video where then he called the major hospital and talked to the pediatrician on call and said, come right away. So me and my partner, we rushed down this Highway 17 corridor because there was no ambulances in the ambulance bay, and we sought services there. He progressively got worse, and was when we arrived, we were just put in the general population ward, but he worsened over a couple of hours, and then he was transferred to the NICU, and then subsequently he was transferred to sick kids because they didn't know what was wrong with him. I was really fortunate where they asked if I had a preference, which hospital would I go to, and where I situated. I said, can we please go to sick kids because I have family in Toronto, versus being the recommendation was also CHEO. So I was very thankful for that. It was really challenging, and I was by myself because I was the one who took Orange. Please remember that I'm 2 months postpartum in this. So you can think, if you know a woman who has given birth and what happens in those 2 months, I was also coping with that in real time. For example, I was an overproducer, so I'm still pumping to save my milk, even that Riker's on, he's unconscious and he's on a feeding tube to get some energy into him. And then we were told that they thought, based on his symptom presentation, that he had a really fast progressing deteriorating disease, and that he would subsequently die. And so we had to prepare for that. And so we were transferred to a children's hospice, and we stayed there for about a week. But they didn't know his diagnosis, so it was all speculative. And so if you see the picture on the bottom left-hand screen that's my husband holding Riker, that's when we were in the hospice. And yeah, so we were like, thinking he was going to pass away, but miraculously Riker got stronger. And we were able to be discharged, and we decided to go back to Northern Ontario so if he died, that he would die in our home. We had made that decision. Riker, subsequently the next month, we were able to get a call from the geneticist, and they're like, he doesn't have what we thought he had. We were like, that was great. But then they're like, we don't know what he has. And so they had to do advanced genetic testing, and we actually didn't get his diagnosis until he was 10 months of age. He was diagnosed with what I define as an ultra rare genetic disorder. It was a spontaneous genetic mutation, and it was called RNF213. At the time, Riker was the 8th known case in the world, and he was the second worst case in presentation of the children that had the disorder. And so because of what they had, they said they didn't think that Riker would make it past the age of 4 or 5, and that was the acceptance that me and my husband had. And so really it was trying to kind of figure out how can we best support ourselves as parents, and navigating that shift of I'm not a parent, I'm not going to be a parent to my child, but I'm going to be a caregiver to him. So that included having, between the 2 months to the 2.5 years of his lifespan, a plethora of specialist appointments. So navigating, traveling back to sick kids, going to the most closest urban town where we lived was about an hour's drive away. And then having specialist appointments such as occupational therapy, physiotherapy, dietetics, infant development support, people coming into our home, navigating the finances. I'm on maternity leave. So there's a lot of different things that were at play. And then I decided that I'm going back to work because I need some semblance of normality. And my job was actually 3 hours away. And so I had a discussion with my husband and said, we're gonna buy another house, and because it's cheaper than renting and we could afford to do it. And I'm gonna take Riker and I'm gonna live in this other town. And my husband had to stay where we were living in this rural community because that's where his work was. And then on his days off, he's a shift worker. We would try to make it work. And then the weekends that he wasn't working, I would drive back just to make it work. And I told my husband, I was like, I'm gonna try as hardest as I can until I can't do it anymore. It lasted 5 months. And he was successfully able to get a transfer, and that really helped. But we both have very high demanding jobs. Again, and I said I work in healthcare, and my husband works in law enforcement. And so you can imagine what we're up against. And we don't really have family around. It really was just me and him. So we have 2 homes, working 2 high demanding full-time jobs. And we have a child that, has complex needs and is palliative. And then as much as I think I have a good financial bracket, it wasn't enough. I wasn't deemed as needing support from a government perspective, but benefits didn't really cover that much. And Riker was failure to thrive, but he wasn't approved for the nutrition program. So he needed Pediasure 3 times a day. So that was out of pocket. And I remember asking people, like, do you have coupons? Like, it's on sale in this area. Can you get some for me? Like, really exhausting. And I also took on a part-time job teaching just because like he was just, his needs were really expensive and his equipment needs. So you can see some of the pictures of, he in the upper left-hand corner, he had a bath seat. He had limited mobility. He really only met his social cues. So, you can see he's always smiling. That was what he was known for. Everybody said he had an infectious smile. And there's a picture where at the third one from the bottom, it's just me and him, and we're both wearing masks. That was actually about 2 months before Riker died. I woke up one morning and he had exhibited a stroke, and I was air ambulance to London that day. The picture above where you see a stander in the background, that's my last picture with Riker smiling. That's a month before he died. And then, in all honesty, the picture with the panda, that's what we called him, is a couple of days before he died. And I needed the final picture of what he would look like as I laid him to rest. And I really get semblance of that. And then on top of that, I was pregnant. I'm sorry, I say I'm a lot, but I did have a daughter, and I found out I was pregnant when Riker was about to turn 2 in February of 2022. I gave birth in November, and Riker died 3 weeks later. So I'm very fortunate, and that bottom picture is the 3 of us with my daughter. That's Alodia and my husband Sean, and that was taken at Christmas a couple months ago. But there's a lot of moving parts to my journey, and there's a lot of positives. You'll see there's a picture with Riker, and he's kind of have his arms out because he's in this it's called a go-to seat, and it was a way that I could finally take him out and he could sit upright. So we're going grocery shopping, and I was just so excited that day. Like, I didn't have to put him in a car seat, or I didn't have to go grocery shopping by myself, just to get, like, he could enjoy the experience. And then the picture above him is him at daycare. And so yeah, there's a lot of ups and downs. I also got a peer mentor in my journey, really helped with my needs and being able to talk to somebody who just got it. I was fortunately matched to somebody that had a child with complex needs, lived in a rural area of Ontario, was Southern Ontario, and just really, like, I looked forward to what I called dates with my peer mentor, and I blocked time on my schedule to have those connections. And then I really wanted to give back. And I knew that when I was going to be on mat leave, I would need something to do. So I said that I would be a peer mentor. And then everything happened, but I still wanted to honor that. And so, yes, in the height of my grief, a month after my son died, I became a peer mentor, and I've had 5 so far. And it's been a great experience being able to connect with other people in Ontario about their caregiving journey from all aspects, from pediatric populations to older populations, and just being a voice, an empathetic voice and listening ear to them. Next slide. So caregivers' well-being is at risk. Caregiver burnout is real, and caregiving well-being is at risk. 79% feel so tired it's difficult to get things done. 78% feel unable to take on more responsibility, and 76% are unable to enjoy activities. Next slide. So we can recognize that this can be challenging both to caregivers and providers to build caregiver support. Caregivers are focusing on the needs of the caregiver and might be unaware of the supports, and caregivers need help to help them think about themselves. So I just really want to emphasize that caregivers need help to help them think about themselves. So when we look at the left-hand side of the slide, some of the barriers that caregivers face are the focus is on the caregiver recipient needs. I'm going to put in context of part of my journey. Like, I always focused on my son. I always focused on my husband, and I really didn't focus on what I needed. Was I burnt out? Absolutely. I had a full-time job. I was away from my husband. I was away from most of my family. And every day after work, I would have to Riker had some type of appointment, whether it was private physiotherapy and occupational therapy, or going to the Children's Treatment Center, having an appointment with a pediatrician, having a virtual appointment. Those things were happening. So yeah, and I was staying up late to catch up on the things I needed. I had flexibility in my job, so if I needed to leave early, I could do that and not lose time, but I would always make up those hours after he went to bed. And sometimes I was unaware of the support that was available. I didn't know what I didn't know, honestly, until I had my peer mentor. That person told me more about the system and things that were available than any of my health cares. And then the stigma involved with it as well. Like, I really didn't want people to feel sorry for me. And a lot of people didn't really know how unwell my son was in my full-time job. Like, I just made it seamless. Like, if he was admitted, I would be working in his room in the hospital and nobody would know I was in there. I just had a few close work colleagues that helped support that, and I just did it. And then I would just keep going. And I think from a provider perspective, providers might feel ill-equipped to support caregivers due to a lack of knowledge of available resources in their community. And the emphasis is to focus on patient needs. We understand that. So there's time pressures to support. There's limited, in terms of time pressures, there's limited time to support caregivers due to the current models of care. Burnt out with healthcare providers, limited human resources, and also trying to support healthcare workers to also have a work-life integration. Sometimes there's lack of clarity in understanding privacy and consent legislation as well. Like, where's that fine line? Should I be helping the patient when they're the ones who are registered versus the caregiver that's not really my patient? And there's a sense of apprehension about being unable to fulfill caregiver expectations, and and the difficult situations that may arise. So today we will walk through some ways to consider how providers organize and how Ontario healthcare teams can offer support in a variety of ways across the continuum. But I ask one thing to stick with you. The simplest thing that you can do for a caregiver is, how are you doing? And really, how are you really doing? Just, it can take 2 seconds, and the way that your tone and inflection can really get a real answer versus them just saying I'm fine. But when you show that you really care, you can make a difference to somebody just on this off of the side when the needs might be focused on the patient. So I'm going to pass it back to Allison, and thank you for listening to me as I shared a brief moment on my caregiving journey.
Catherine, thank you so much. Thanks so much for, sharing not only kind of your insights and your kind of your shared your kind of perspectives, but also your very, very personal journey, for sharing Riker with us, and for really weaving in all the different pieces of yourself and Riker and your family, to really help us understand in a really real way how critical support is for caregivers. So thank you. And I see so many lovely notes coming through the chat. Thanks, everyone. So, so much of what Catherine has talked about, we've already kind of heard so far about how caregivers across Ontario are struggling. We've heard from Catherine about how critical caregiver support is and how critical it was for her own experience. So I'm going to spend the next few minutes really focusing in on why caregiver support is so critical for OHTs and for organizations. So if we don't pay attention to caregivers as a population, there are real consequences for caregivers and also consequences for the healthcare system. When caregivers aren't considered or included in OHT plans, care pathways, they're really missed as a population. And as a result, there's a real risk to the healthcare system and to these kind of new and improved patient care pathways that OHTs are working on. And I love this quote that kind of really talks about the kind of consequence of what will happen if we miss the boat, right? If we really miss the opportunity of critically linking caregivers to support. And of course, some of that consequences is that they become collateral casualties of either the person they're caring for, the system, and that has a very real certainly personal cost to the caregiver, but also real cost to the health system as a whole. So as your OHT strives to improve patient care and to ensure equitable healthcare, improve efficiencies, it really ensuring that caregivers are supported is critical. So, one of the things to think about here with some of the pieces, especially that Catherine mentioned, when we think about some of those really high numbers in terms of caregiver distress, I think it's really important to understand the impact of that distress. So if caregivers aren't well, patients aren't well either. Caregiver well-being, in fact, has a direct impact on the person they're caring for. So, and if caregivers aren't well, it certainly can impact their capacity to care for the person that they're caring for. And this means it can lead to a number of factors, and I'll speak to that a little bit on the next slide. But here I want to also kind of highlight that, not surprisingly, there's a link between caregivers' own mental health and how this impacts the patient's clinical and mental health outcomes. So as you develop your clinical pathways, your improved plans for reduced ALC, your transitions from hospital to home, really consider how well you have built caregiver support into these pathways, because that will be critical in making sure that the best patient outcomes happen as well. Next slide, please. So we recognize as OHTs, you're working to improve things like discharge and transitions, reducing ED usage across the healthcare system. And of course, caregiver well-being directly impacts these efficiencies and patient care. In particular, I want to highlight the links between caregiver distress and health system usage. So caregiver distress can have an impact on delayed transitions from hospital to home, readmission rates, increased use of home support, and heightened risk of emergency department use, especially for older adult patient populations, which are a focus of many OHTs across the province. And I really appreciate this quote, that thinking about, you can have the best laid plans for even a hospital admission education program that's well resourced, that's well thought out. But if the caregiver has not been taken into account, and their well-being in particular, it's not going to work. It's going to fall apart. Next slide, please. So the other thing that I want to really highlight is, as we consider all these factors that we've talked about so far and the impact of caregiver well-being on patient care and outcomes and the system, we're also moving into a future where we can anticipate increased demands of our system. OCO recently released a new report about the preparedness of folks in Ontario to become caregivers. And so from that report, we understand that by 2029, Ontario's population, of course, will grow. There'll be an increased number of Ontarians living with chronic illness, and the pressure on our health system and on family caregivers will increase. And in particular, we can anticipate an additional 2.5 million caregivers in Ontario by 2029. So really, you can see that it becomes imperative that OHTs consider the role of caregivers in care plans, in redesign, in hospital-to-home transitions, and work to reduce ALC in the goal of achieving safe, equitable care. Without the consideration of caregivers as a key population, it's a missed opportunity. It's a missed opportunity for improved patient, provider, and the system. And so I'm going to talk a little bit now about what we can do about it. So I think, this is a key moment and a key opportunity. So it's an opportunity to build capacity across your OHT to provide caregiver support for caregivers now and also for caregivers to come. So when we think about doing that, we need kind of a broad, coordinated scale up of programs, policies, and practices to support caregivers as part of a kind of big strategy to improve caregiver and care recipient health outcomes. Your OHT has many organizations offering a range of caregiver support across your region right now. So I think it becomes critical to collaborate and build partnerships and understand and truly understand the types of caregiver supports currently offered and also what gaps exist across your region. So in a kind of strained and fragmented healthcare system, OHTs and the collaborations and innovation you forge across your settings, it becomes really critical. A population health approach is incredibly important to meet caregiver needs, to reduce unmet caregiver needs, and really improve caregiver and care recipient outcomes. So as you plan and think about how to do this work, it's also really critical to partner with caregivers to understand what they need and to make sure that caregivers are really part of informing what specific supports are required to help caregivers best in your OHT and in your region. Next slide, please. So I'm going to shift gears and talk a little bit about some of the resources that we've recently developed to help you do this work. In consultation with providers and caregivers across Ontario, we developed this resource that can help your OHT and your organization to understand caregiver supports in your area. So this resource can help to identify the types of caregiver support in your region, identify possible gaps in services, and explore opportunities to build caregiver support into planning. So I'll give you a snapshot now of what you can find in this resource. We've categorized caregiver support into 3 overarching areas. So future and financial planning, social and mental health support, and practical daily support. So understanding these categories and the types of caregiver support that fall under each category provides an opportunity for your OHT to work with organizations within your region to identify which type of supports you have available and who currently offers these types of supports, because we know that these supports are already being offered across Ontario. Next slide, please. The resource also includes definitions and subtypes of caregiver support offered under each 3 categories, and really providing some important details and information about what could be offered. So as you think about and collaborate with partners in your OHT, using this as a bit of a guide to understand what currently is in place, where there's a gap, what might mean we need to learn more about in order to be able to work together to provide this type of support is helpful to think about. Next slide, please. The resource also includes and touches on a number of gaps and inequities in access to caregiver support. We heard earlier from Catherine about the challenges faced by caregivers in Northern Ontario in particular, and certainly we heard throughout the development process for this resource from caregivers and providers about disparities in regions and what is available for caregivers depending on regional areas. In addition, of course, there are a number of cultural and language inequities and variation in service costs. So these insights really make it even more important to consider how you can work across your OHT and your region to reduce these inequities and together build on the assets within your community. Not surprising, of course, current gaps that were identified through the development of this resource included support services like respite, system navigation, and financial support. This part of the resource also offers and highlights moments where organizations can make sure that caregivers receive information and are connected to support for their own well-being and those kind of key moments in care. Primary care teams, hospitals, community-based organizations, moments upon diagnosis of a care recipient at a transition point, signs when there's caregiver distress, and definitely earlier before caregiver distress fits in. These are those kind of key moments and places and spaces where that can happen. So when you think about this work, have you missed opportunities in your care pathways to consider the needs of caregivers? And I'm going to talk now more about some of these key moments and what that could look like. So as you work together in your OHT and with partners, we encourage you to leverage and build on the work within your OHT community to identify existing organizations that are offering caregiver-specific supports in local communities and in regions. So for example, Alzheimer's societies are well positioned to provide insights and provide caregiver-specific supports. They're doing that already. And as you build your understanding of your local, regional caregiver supports and programs, really consider who at the table already provides caregiver-specific support and expertise, and that's tangible work that you can build from. You can also point to and refer caregivers, of course, to OCO's programs and services. So this can be a bit of a gap filler where there may be gaps in local services. And by connecting caregivers to OCO, and particularly the OCO helpline, they'll then, of course, be connected both to OCO programs and services to support their own needs, as well as support to meet the needs of their care recipient in their own community. I'm going to shift now to talk about how you can identify caregivers and connect caregivers to support at your organizations, really, and at point of care. And by doing this, I'm going to walk through another new resource that we've developed that I think will be really helpful in doing this. So if you go to the next slide, please. This resource that we've developed called Connecting Caregivers to Support at Point of Care can help healthcare organizations and point of care providers to help identify caregivers in key moments of care, help understand and determine what they need, and then, of course, connect them to support. What we know is that caregivers don't often self-identify, right? It's quite, I would say it's more unusual that someone calls our helpline, or certainly that has an interaction within the healthcare system that says, I'm a caregiver and I need support for this. Rather, caregivers are often navigating the healthcare system and looking for support for someone they're caring for. Their caregivers may be facing challenges, but are unsure exactly of what they need or what may be available to them. And this may look or sound like, someone saying, I'm asking for my dad, or I'm caring for my mom. My child is living with a disability. My sister's sick and going through cancer treatment, so I'm making this call on her behalf. And so I think it's really important to kind of look for those hidden messages when caregivers really are in a position of being a caregiver, but maybe they actually haven't realized it yet for themselves. And this is where I think there are some very key opportunities for healthcare providers to help caregivers identify as caregivers in order to help connect them to support they need. Next slide. So in your roles, you have an opportunity to help caregiver identification and then connect them to support. So once you talk through immediate needs, for instance, you don't want to bypass the fact that their own focus, even as Catherine outlined, is on the care recipient, is on the patient. But this is an opportunity to add additional speaking points, right? It sounds like you're providing care to your mom, but we can also connect you to support for you as well. Do you have time to focus on your own health? Would you like to take a moment to talk through some support options for you as well? These are some of the language that we found has been helpful to help caregivers center their own supports and help them to consider that their own needs need to be supported as well. And if you recall from Catherine's comments at the beginning of the webinar, this is where it's really important to help caregivers be able to recognize that they need help and help them get there. And healthcare providers can play a key role in doing that. Next slide, please. So in this resource, we also share some of the common situations and challenges faced by caregivers and really present starting points for offering support. It's not an exhaustive list, but it's a helpful tool in terms of those key starting points. And certainly in this resource, we highlight OCO programs and as well as other programs offered throughout the province. I'm going to wrap up by reminding folks that we, of course, have our own programs and services offered through OCO. These are free for caregivers. The helpline is a fantastic resource that directs caregivers to support for their own well-being through programs and services offered by OCO, such as some of these others listed here, but also can connect them to support for their care recipient. Our peer support program, Catherine mentioned, she's an amazing peer support mentor, and we have other wonderful peer support mentors working across Ontario to support caregivers. We have a number of online support groups that are facilitated by experienced caregivers as well. We have amazing monthly webinars for caregivers as well as for providers like this one. And we have a SCALE program, this 8-week program, which is actually happening right now. It started in February, is a fantastic program, really targeted on caregiver mental health and well-being. So these are just some of the examples of the programs and services offered by OCO. And as I mentioned before, can be helpful in kind of filling the gaps that your own organizations or OHTs or healthcare organizations may not have on offer at the time. I'm going to now really invite back into the room Catherine and Lisa, who will help us and have a good conversation about what we can do more.
Thanks so much, Allison. And Catherine, I just want to share a big thank you for sharing your story. And I've been watching the chat, and there's so many people thanking you for sharing and for opening yourself up to sharing your story. We will make some time for some specific questions, but first we'd like to delve in a little deeper with Allison and Catherine. Catherine, I know you had made a suggestion to folks on the webinar today to ask caregivers how they're doing. Did anyone offer you support when you were going through your caregiving situation?
Yeah, when I think about from a professional perspective, when we had two different children's treatment centers because I moved a year after Riker was like after when he was 1 year old. So the first children's treatment center, one of the physiotherapists had made mention of that I could connect to a social worker, and then she supported me, and I really appreciated that, and I formed a really good connection with her therapeutically, and we wasn't a focus on Riker. It was like her helping me have a thought process to start taking care of myself, which is ironic because I work in mental health. But as healthcare professionals, sometimes you don't practice what you preach. And so I really appreciated that relationship. But then when I moved, the social work services were different in the next region of Northern Ontario that I was. So I didn't have that therapeutic connection. So she was really important professionally. And then the two infant development screening coordinators that I had in the two regions that I was were very helpful as well, and like really trying to normalize like he's normal in this capacity and in his milestones, and then and then there's things where he's not reaching, but like trying to help me close up positivity as a parent instead of always trying to be like me seeing I'm a caregiver, not a parent to my child. So that was really helpful. And the two pediatricians as well, they were different, but they did ask, like, do you need anything? And then at Sick Kids, they have the palliative care, advanced care team. So Riker, because of his palliation prognosis, he was part of that team. And so we were in and out with using their services. And so they were really helpful at the beginning in the first in that time period, that first time where I said we were flowing to Sick Kids and he was going to pass away. Like they were really helpful. And then we didn't really need them, but they came back as soon as they found out that Riker had passed, because he actually died at another children's hospital. Because I moved, I was at a different catchment area. It was RSV and there was actually no beds. And so he was transferred to London. So that's where he died. But when the PAC team was aware of Riker's death, then they were very instrumental in helping with my grief caregiving journey, and still are. So I still connect with services even 2.5 years later with them. Personally, prior to having my peer support mentor, I saw a question in the chat. It was COVID. So everybody knows that everybody was locked up in their houses. And so I really leaned on virtual, and connecting with my family was really like my sister and my brother and my parents. And then I have a close network of friends, like 3 friends that I do regularly talk to virtually. So that just continuing that seamlessness has really helped. And even today, even that we live all different areas of Ontario, and one of them is across in a different time zone, we've maintained that. So those people were really helpful and continue to be helpful to me.
Thanks, Catherine. And it's good to know that there were folks who reached out to you and asked, people that were involved in Riker's care and you as a parent. So you did answer the one question in the chat.
Mm-hmm.
It sounds like it was close friends and family who were your source of strength before you entered into that peer mentor relationship. Do you think there were any missed opportunities, anything that stands out in your journey, any missed opportunities, or, oh, I wish they would have done this or asked me about that, or I wish I would have had this type of support? Anything that you can think of?
Yeah, like the services between the two regions were different, and for various many reasons. I wish that some services I had in the first region were replicated in the second region. There was services that happened in the second region that didn't happen in the first region. So one example was the second region gave me the Children's Treatment Center had additional funding for me for respite services that wasn't through special services at home. And that was like the only funding I had. So it was just a small pocket of like $3,500. And so getting an extra, I think it was 1,000, was really helpful to utilize those respite services, specifically for respite, because at the time, special services at home had opened up their category. So it wasn't just respite. You could use the money for other things. So like we bought an iPad, some of his equipment I was able to successfully say like it was a therapeutic need. So some of his toys actually. So that was really helpful to be able to navigate it that way. My family doctor, like when I moved to, so I kept my family doctor when I moved to the second region because he understood the journey. He was there, and but he was like 2.5. No, he was 4 hours away. So that was a challenge. Family doctor, not having your family doctor close. And I was very lucky, I'll be honest. Everybody knows that Northern Ontario has a high percentage of family doctor shortage right now. And when I gave birth to my daughter, Riker was admitted when I was in recovery, and he was flown out the next day for that last end of life, those 3 weeks. So the family GP on call who checks the mother, 48 hours after the baby is born, was very like everybody knew what was happening, like between the pediatric unit and maternity with me, and she was really. They were all very helpful in terms of what I needed to get to London with my daughter. So I was very thankful, but like there were missed opportunities where like there were some times where, I'm sorry, there's a lot of missed opportunities, but one was, I'm just going to jump back, sorry, because I just remembered. When Riker, 6 weeks before Riker had this last episode that led to his death, he had a stroke. So I woke up and he was air ambulanced to London. And then when he was discharged, I was 35 weeks pregnant. They were like, okay, you can like go back to Northern Ontario, but I flew orange there, so it was just me. And they're like, hey, come have your husband pick you up. And I was like, what? And I was like, no, I'm like, he's 10 hours away, and you just discharged my son who had a stroke, and you want him to drive us back. So I'm a hard advocate, you might be able to see as my personality. And I was successfully able to have a repatriation back with the support of the pediatricians, because all the most, I would say not all, but like I think most of the pediatricians knew of my son's case history where I lived. And so they agreed to take him back, and then so I didn't have to drive. So just sometimes not understanding, like, and it's no fault to the healthcare professionals of where in London, I don't want to say ill of them, but I really think at that time they weren't understanding. Like, it's not a hop, skip, and a drive. It's not a hop, skip, and a jump to drive. Especially again, like I just had a son. He like he can't even sit up properly. I didn't have a car seat because in one thing it was like, well, you can go fly a commercial airline. I'm like, I don't even think they're going to take me because I'm 35 weeks pregnant, and I was high risk too. So just missed opportunities to really holistically look. Other things is that when your children's admitted in the hospital when they're medically complex, the focus is on the medical piece. But my focus was always on the allied health piece with like physio and OT. And so I just feel like there's sometimes a hierarchy. And like I was like, no, I'm like, I never wanted Riker to lose things that he gained from all of the physical activities that we were doing for his therapy. And so I would be doing his home, like the exercises in bed with him. And sometimes I'd have to ask, I'm like, can you please get the physiotherapist in here? Can you get a mat so that I can bring floor play with him so I can get his body moving? Or he didn't have equipment like the go-to seat or the the go-to seat, or sometimes like these just special chairs that would help him sit up in bed, that he need for core support. So those are sometimes missed opportunities that I was seeing when he was admitted, which was really quite frequently.
Yeah, and that not every situation is different, and
Mhm.
to pay attention to you know, what the people, the family, and the child actually need for their own certain circumstance. I'm just keeping an eye on time. We have 5 minutes. What do
Sorry.
you, Kath? No, it's great. Everyone is appreciating the conversation. Allison and Catherine, what do you see? You know, having, you know, hearing what Catherine had to share, what do you see as opportunities for healthcare settings, or in particular for OHTs? What are some of the opportunities?
Maybe I'll jump in and then Catherine, feel free to add. But you know, as I was even reflecting on listening to Catherine earlier and kind of summing up some of the points that I was talking about earlier, I think that some of the opportunity is like taking a double approach, like a prevention approach and then an intervention approach, because you've got to be able to address those key moments for caregivers throughout the healthcare system. But there's this giant opportunity for prevention in terms of caregivers who at the beginning of their journey who need that, who need support to help even identify themselves as caregivers, who may not be ready now to accept some help, but given some kind of early information and resources might then be caught and be able to be prevented from experiencing pretty severe burnout. So those are some of the pieces I was thinking about.
My suggestion is always like, go talk to people, you know. If you have the capacity in your positions to like go to a hospital or long-term care or children's treatment center, we want to talk and we want you to know, and it gives you more insight to those journeys, and we enjoy those. I think caregivers would enjoy those conversations. It might just take a little bit, like someone's paying attention to me and caring about me. So that's an idea that I would have for the Ontario Health teams.
Thank you. We have a question, and maybe this can offer a response as far as an opportunity. Kathleen had asked if there was communication between the catchment areas, and did each area know what the others had to offer as far as resources, or were they more siloed and separate from each other?
No, I think that I think between the two regions that I lived in, that there was great communication with transfer accountability and transfer of care. I think they could only do so much and know what was in the community to cross-link that. So like the two infant screening coordinators talked to each other. So I knew that was happening. I knew that the physiotherapist and occupational therapist talked to each other. I had some inclination that the service provision might change, but maybe I was in denial, that I was like, it should be the same. Like it dropped from going in person biweekly to one region to still seeing biweekly, but one was like virtual and one was in person. And I didn't like that. But the other one was a little bit more flexible because the new region, they were very supportive of doing evening things. So I didn't have to take time off work. So I don't think they were siloed. I think there was great communication and always seeing improvements from both lenses, but there's always opportunities for growth.
Absolutely.
And they did a case consultation. That was really important. So like I felt I was the center of like, this is what I need. And both sides were hearing that, and then they took it offline to make sure that they can make that connection of services happen.
Thanks so much, Allison. Thank you, Catherine. Do you have anything to add?
No, I think that's great. I was just thinking the last opportunity I was thinking about was just recognizing, even as Catherine has noted, you know, she herself worked in healthcare. Like there's those double duty caregivers who are caregiving at work and caregiving at home. And I think that that's another opportunity OHTs, healthcare organizations, can think about.
One other thing that as we were preparing to discuss, it was like, there's opportunities to not put the burden all on the clinical frontline staff and use support staff. So think of office assistants, administrative assistants to say, while they're checking in a patient and they see that they're with a caregiver, just, you know, maybe giving something about the OCO, or do you need any caregiver supports? They can read, they can pass off something, and it could be kind of indiscreetly. And, you know, just to let them know that we're holistically looking at everybody in the patient care journey.
Thanks so much, Kathleen. So a team effort, not just the direct clinician or support provider, but even someone else working in the office, they can contribute and help out. Before I turn it back to you, Allison, Felicia, one of our co-workers, has put links in the chat for where you can find various resources that the Ontario Caregiver Organization has to offer. So thanks to you both for sharing your stories and your insights. Allison, I will turn it back over to you.
Thanks, Fredosa, and thanks you, Lisa and Fredosa. If you can kind of skip ahead, I'm just it's already 2 o'clock, so I'm just going to quickly wrap it up. And thank everyone so much for joining us today. I really encourage you to explore these resources, understand the assets your OHT has to offer, identify gaps in caregiver support, and collaborate with partners to meet those gaps. We'll be sharing right now a link in the chat to evaluate our webinar today. We'd love to hear how we can do things a little bit better. We'll also be sending out these resources as well as a summary of today's webinar out to everyone, but we do encourage you to reach out to us and reach out for support. We're keen to work with folks to help you build caregivers into your OHT plans. Thank you so much for joining us today. And again, special thanks to Catherine for sharing her story, her voice, and her perspective with us. Take care, everyone.